Dear friends, welcome back to my channel Alpha Physiopelvic Care. My name is Anastasia Varova, and as you might have known, but if you're watching me for the first time, I'm practicing pelvic floor physiotherapist, and here in my channel I'm sharing all my tips about pelvic floor. Today I will show you a small complex of movement and exercises that I get requested actually a lot, and it's related to coccyx pain, coccyx or tailbone pain. Tailbone is the last bit of bone that is right at the end of our spine. And quite often it gets injured in a various way. It can be through the falls, it can be through the accidents, coccyx can be fractured. Quite often I see coccyx injuries also after childbirth. People don't really know what to do about this pain because it can be so uncomfortable and disturbing, because in the modern life most of our work is related to sitting. And when you sit, what do? That's right, you put pressure through your coccyx. So what to do about it? There are various management strategies, and today I will show you complex of exercises and stretches you can do at the end of the day, especially if you sit a lot, to relieve the coccyx pain. Before that, I would like to say thank you for watching this video and taking interest in the topic of pelvic floor, and I would really appreciate your like under this video and subscribe for more videos, everything pelvic health. A very quick anatomy lesson. So if you look here from the inside of the pelvis, here is the coccyx, and from the back here is the coccyx. So it's actually a place where a lot of muscles enter. Most of the pelvic floor muscles sooner or later end up in the coccyx, and because you don't see all the muscles here, also your gluteal, your butt cheeks, your bottom muscles are inserting into coccyx. So there is a lot of going on around this little bone, and it's very important to keep it pressure free, to keep it as mobile as possible in order to be as pain free as possible. Another thing I would like to mention is also anococcygeal ligament. This ligament here that connects your anal sphincter to the coccyx and stabilizes them, and this is also very important. I have seen in my practice people who would have a lot of spasm around their anus, a lot of pain around their anus near the coccyx, and I would work with this particular ligament and also the anal sphincters, and the pain would substantially reduce. But today I would like to show you what you can do at home in order to reduce the pain. Let's go. You will need a little bit of equipment, so you will need a smaller towel. You can take a little bit bigger one, it's up to your comfort, and a trigger point ball. Now this is a special ball and it's not very soft. I like a little bit harder ball. You might be quite sensitive to the pressure and you won't want to get something softer, but you don't have to have anything fancy. You can just get a simple tennis ball. I think these are much more accessible than a special trigger point ball. We will start here in 4-point kneeling because this is most logical position to remove the pressure from your coccyx. So 4-point kneeling, coccyx is completely free, and we would like to start to open up that pelvic floor, stretch out the gluteal muscles in order to reduce the tension on the coccyx. I do prefer to ask people to drop on their elbows because it's more relaxing. They allow their back to arch a bit, and that's all right, which makes a more posterior pelvic tilt. So instead of having coccyx down and compressed and tensed by the muscles, we let it open up and kind of stick out. Of course, it depends on the anatomy. If you have a broken coccyx that is under 90 degrees flexion, it might not go completely up, but still we give it space to move. You drop onto your elbows, and here I'm really giving myself freedom of movement, and I'm taking long breath in, thinking about my sitting bones here, and thinking about opening them up on the breath in. And as I breathe out, I gently return and let my tailbone tuck in. And then I breathe in, open up. You take nice long breath inside your ribs and keep your belly relaxed, and breathe out. This is very basic, very easy, yet many people don't do it. Most of the people don't do it. And this is perfect stretch for the end of the day to reduce pressure on your back, to take off that load from the back, and to also open up the pelvic floor, release tension from the pelvic floor, and of course your tailbone. So you repeat this exercise, breathe in and gently breathe out. You don't need to tensen up anything, you just breathe and move, rocking backward and forward. Of course, you can do a variation by rotating a little bit, anything that opens up your pelvis. And you repeat it for about a minute or even up to 2 minutes. I'm not giving you here the repetition because you really don't need to stress yourself out with repetitions. Next two exercises, stretches, we're going to do on our back. And whilst we're laying down on our back, there is some pressure going on through sacral bone. The sacral bone is the bone that comes before the coccyx. We are going here to make it a little bit easier. And again, open up our pelvic floor and our pelvis and give some space to the coccyx. So we grab our legs and we just take nice deep breaths in and keep rocking. Whilst we do that, what I want you to focus here on is taking nice deep breath and thinking about the area, the perineal area here, and releasing it. I would not suggest you to wear anything tight. Try not to do it with the jeans or any tight clothing because you might feel that compression of the clothing going on. So something really, really loose and comfortable. Then you slightly open up, breathing in. Long breath in, breathe out. We also stretch here our hamstring muscles and a bit of adductors, and hamstring, they do attach to the pelvis. They don't go directly to the coccyx, but they do attach to the pelvis. And if you have tight hamstrings, you will have more compressed bottom part of the pelvis, and it will affect how your coccyx feel. But they do attach to the pelvis. And if you have tight hamstrings, you will have more compressed bottom part of the pelvis, and it will affect how your coccyx feel. So we roll here and stretch for about 1 or 2 minutes. If you want, of course, you can do it longer, but here I'm always trying to optimize people's time because I know people are busy. They're busy, they have things to do, so I really try just to optimize their time and make sure they're done within 8 to 10 minutes. Third exercise, we are going to do variation of the classic bridge. Again, if I'm laying down here, quite a bit of pressure through my sacrum, probably coccyx. So what I will do is I will take a towel, and if you have heard about the pelvic dimples, the 2 little dimples you have here on your pelvis, right? If you can actually feel them, if you stand, the 2 dimples, this is the area of so-called posterior iliac spines. Forgot about it. So we place it there, okay? Now, if I relax over the towel, I'm kind of dropping a little bit down with my pelvis, all right? There is space created and not so much pressure on my coccyx. This should not be uncomfortable. I do feel some pressure higher up, but my coccyx is kind of dropping down. So from here, I'm already a little bit arched. I'm taking nice deep breath in. I'm breathing out, tucking my tailbone in gently, vertebra by vertebra, lifting up. You can do a gentle pelvic floor squeeze here as well. And then I'm breathing in. I'm coming to that towel and letting myself arch over it. Okay? It's not up here. We need it lower down on your pelvis. I'm breathing in and breathing out. Let myself arch. So you go into both movement, posterior pelvic tilt, so the tucking in, the scooping, and you go in the opposite direction of letting it open up and arch. And you gently repeat this for about a minute. I would say 10-12 repetitions. You don't want a lot of clenching here of your bottom cheeks because this can actually exacerbate the coccyx discomfort So we really want flowy, gentle movements. So we breathe in as we're down, breathe out as we go up. Breathe in and breathe out. Great, and let's move on. The time has come to use our ball. So this ball, as I said, it's quite hard and it's quite pointy. I do prefer a little bit harder pressure, but you might want something softer. What you can do is you can place the towel on the ball, okay? And it will make it less pointy. What I'm doing here, I'm placing the ball on my gluteal muscle, on my bottom cheek muscle, which is around here, okay? I'm not going directly on the bone, on the coccyx. Here is the soft bit. I'm using my hands to support my weight, and I'm also using my pelvis to move. So here I'm tucking my tailbone in and I'm arching. The ball stays on the place, and I already feel there is quite a bit of tension in the gluteal muscle happening. So I'm rotating and releasing that tension whilst taking long breaths. You can also stay in one spot. The more you arch your back and go away from the ball, less pressure. The more you sink into the ball, the more pressure. Here, I would really leave it up to you how much pressure you can take, because people have different pain thresholds. So in essence, it's a self-massage of the gluteal area. Great, and of course, you repeat it on both sides. Now, I'm not a great advocate to do the direct coccyx pressure, because some people might feel it really, really hard and it's hard for them to do. If you do feel that you want a release with a direct pressure around the coccyx, particularly around the anal sphincters and the anal-coccygeal ligament, the one that I showed you last time, I'd suggest to start with something really mild, right? You don't want to dig in immediately with the trigger point ball. To place it essentially in between your butt cheeks. Sit here, support yourself with the arms and legs, and see if this pressure helps you with your pain. So right now I'm sitting directly with my coccyx, okay, on the towel. Not a lot of pressure coming from the towel, but there is some. So you can roll from one side to another, not for it to be a constant pressure. You can come a little bit more forward and go straight directly onto anal sphincter, especially if you know you do have some tension there or some spasms. But the most important things, my friends, is breathing, okay? You don't want here, hold your breath and wait for it. It won't release if you won't breathe. And if it's not comfortable, it's not comfortable, and don't push through that pain. That's fine. Not every single technique will be comfortable. If you though can do this technique, again, 1-2 minutes, and there is no need to do more. This is enough for one time, because the more we push and press, we might actually exacerbate the pain. Let me know if you do suffer from coccyx pain. Let me know what helped you to deal with it. Any techniques, any other management strategies. If you found this video useful, I would really appreciate your like, and also share this video with your friends on your social media. I know it's not talked a lot about pelvic health, but let's break the taboo together. And thank you for watching, and we'll see you back very, very soon. Bye.